Welcome back, my friends, to my last brain cell. How y'all doing? Happy Friday, Junior, y'all. You feel me? I hope your first full week of October, aka the spooky season, aka the beginning of the winter arc, has been treating you all right. October has been pretty smooth for me. This week has been pretty okay as well. Yeah. So, like the last episode, we are going to continue playing NYC Emergency Room Medical Mysteries. Now, we went through the tutorial with my homie Nurse Judy. You feel me? So now it's time to really get cracking. So now we're gonna take on patient one, and her name is Shyla Patel. We're gonna put other things to the side. Okay, before you play, make sure you have all the game parts, or all game parts are included in this envelope. Oh, in this envelope. Okay, we're gonna pull everything out, and I'm pretty sure I'm gonna need some stuff from here. Oh, human anatomy back here. That's cool. The other one doesn't have it. Okay, so I need the patient form. That's not it. Patient form. Patient form. That's her intake interview. So this must be her patient form. Nope, that's the epilogue. So don't want to look at this until we're done. So maybe this is her patient form. No, it's in here somewhere. No, stop. Okay, we need one patient form. And maybe it's not in here. Oh, I wonder if they're in here. No? Okay, we'll figure that out in a little bit. Her patient intake interview and her EMR, her electronic medical record. 32 story cards. Yes. And 4 status cards. Yes. And her epilogue sheet. Oh, is this it right here? Patient form. So make sure we grab our handy dandy pencil to make notes. All right, y'all. Shall we start from the beginning? Let's read her intake interview. Shyla Patel, age 37. The patient speaks quickly. Oh, you know what? Before we go any further, let's make sure we break out, because I feel like we're going to need that. Oh, it wasn't in here. It was in this one. The result code sheet. I feel like it's something I'm going to need for every single one. I need research sheets. Yeah, so it says in this, the codes research rules. I'm going to need this for everything. I'm going to need the research sheets for the patients. Are these just copies of the same stuff, or are these all? Oh no, it's a few different research sheets. Okay, we're going to need all of these. So remember how the first one had limited stuff? Well, this has a bunch of stuff. There's gynecology, there's brain health, there's a bunch of stuff. And we're going to need the rules of play, I guess. Okay. Well, let's start with the rules of play. Now, we basically read all this. Oh, no, we didn't. I played the tutorial. Okay, so I should be starting with this every time I want to do a patient, it looks like? Or maybe not. I think just for patient one, it wants me to do this. All right, so we will read this whole thing. Rules of play. Start here. Welcome to New York Emergency. I wish the tutorial told me to read this part. It's always busy here, but there's enough time right now to give you a quick tour. You'll be working the graveyard shift from midnight to 8 a.m. We see some real challenging cases this late at night. Your goal with each patient is to uncover the cause of their mysterious symptoms and help them survive the night. If this is your first time experiencing medical mysteries, it's best to follow the tutorial with Nurse Judy. Now, we did the tutorial with Nurse Judy, so we're going to skip the rest of this blurb here. Patient 1, Shyla Patel. Once you've completed the tutorial, you're ready to start your shift. Select a patient. We recommend starting with patient 1, Shyla Patel. For the record, she's also rated easy, just like the tutorial was. Nope, yeah, she's also rated easy. Leave the other patient envelopes closed. Make sure you have all the materials listed. Read the intake interview, which is in front of me somewhere. Perfect. Read the intake interview and the EMR to learn about her condition. Pay attention to small details. Familiarize yourself with the research sheets. You will find those in the envelope called Codes Research Rules, which we did break out. These provide critical details about the procedures, tests, conditions, drugs, and specialists to which you have access. No need to read them completely through right now. A quick scan will do, since you can refer to them anytime you want when playing patients 1 to 4. It's time to take action. Take a look at the patient status card, SC1. All right, so I'm going to not read any more of this. And we're gonna just jump right in. So let's read her intake interview. Shaila Patel, 37, female. The patient speaks quickly, as if she's extremely agitated and anxious. It started when I was running, chest pain and trouble breathing. What was the pain like? A tightness and pressure in my chest. Yes, it still hurts. Not as bad though. At first, it was a stabbing pain, 9 out of 10. Now it feels more crampy. Do I still have shortness of breath? Yeah, I do. Come to think of it, I've been more short of breath than usual during my runs. For how long? At least a month. And I've been having trouble sleeping. This is the final report. Okay, so she's having trouble sleeping. She's having tightness in her chest and shortness of breath when running, and it's been happening for a month. Look, I don't understand what's happening. I'm real healthy. I have to be. I'm a marathon runner. I eat right and take care of myself, though my weight's been creeping up lately. Maybe she's pregnant. Doesn't seem to matter what I do. I don't know why I even said that. As she talks, her words get faster and faster. You tell her to take a deep breath and that it's okay if she has to take a moment to collect herself. I'm feeling kind of foolish right now, like I'm exaggerating what I'm feeling. This is New York City. Everyone has a stressful lifestyle. I'm a full-time biochemist. No, it's definitely something she's working with. The hours are long, but I relax by going for a 5 to 8 mile run around Greenwich Village in the evenings after work. Longer on Sundays when I have more time because I'm training for the upcoming New York Marathon. I make sure I eat a good balance of carbs and protein for energy and muscle growth. I stay away from refined sugar. That stuff will kill you. I have 1 cup of coffee in the morning, occasionally a second in the afternoon if it's been a hard day. So it's definitely not a caffeine problem. I have a glass of wine maybe once a week. I stick to natural drinks like guarana. It's organic and non-GMO. I have 1 or 2 a day, depending on my energy levels. Maybe it is something to do with caffeine. Same with the supplements I take. I won't touch steroids or drugs, and definitely no cigarettes, not even pot. I'm a runner. I need my lungs. All right, so now we're going to grab story card 1. Take story card 1 and SC card 1 because she's agitated and she's anxious. Okay, so let's see. Interview. Question 1. What supplements are you taking? Wait, spend 1 action per 2 questions. Okay, so remember, we only have a finite amount of actions before we have to move on to like the next hour, right? Or next 2 hours. I get 3 actions per 2 hours. So there's 5 questions on here. What supplements are you taking? How much sleep are you getting? When did you start running? Are you sexually active? And what chemicals are you exposed to at work? So I want to ask her what chemicals she's exposed to at work and if she is sexually active. And for that, I need to then turn to my handy dandy result code here. And we're going to look for codes AZZ for what chemicals are you taking. We're gonna start there. AZZ said to take story card 8. Right then. I'm a biochemist for a pharmaceutical startup. We're going to be releasing a groundbreaking drug in the coming year. I can't talk about it, but it's exciting. What I can say is that I'm not around anything toxic. Trust me, my employer is paranoid about us getting hurt. That might impact the stock price when they try to sell to a big investor. Okay, so work non-toxic. The result was AZZ. All right, hold on. Oh, yeah, all right, let's word that a little bit better. Asked about work. Code was AZZ. Notes: no toxic chems. Since there's no toxic chemicals. And like I said, I definitely want to ask her if she's sexually active. Because the first, she said her weight is creeping up. She said she's been having trouble sleeping. She didn't say anything about being sick though. But I am curious. So are you sexually active? HXX. Take story card 14. Boppada boopity boppity boopity. Of course, I use birth control. I can't afford to let a guy get me pregnant. Not that that's going to happen. Like I said, whoa. With my job, there's not much time left for dating. I do see Tom from time to time. You know, our friend with benefits. We're exclusive, so he's not sleeping with anyone else. I had an IUD put in about 8 years ago, and I haven't had a period since then. So I'm not worried about getting pregnant. It's at least a year before I need to replace. I need to replace it. What? It's not my medical records? I guess the clinic didn't pass the information along. She needs another year before she has to replace her IUD. Okay. Sex question mark HXX IUD next year replace. I feel like that might be pertinent. I don't know why. Let's look at her EMR. Okay, shortness of breath, chest pain, and she's complaining of nausea. She's allergic to penicillin. She's not taking any supplements, or she's only taking supplements or workout supplements. Her results were fine. Her past medical history, rheumatic fever at age 5. She has had an anxiety disorder since adolescence, so maybe why she's speaking so fast, and panic attacks occasionally over the past 10 years. Family history: mother and 3 siblings are alive and well. Her father died from a myocardial infarction. Oh, I never heard it called that way. A heart attack at age 67, and hypertension, high blood pressure. And they immigrated from India at age 6. Her exam: general, somewhat short of breath, but able to speak in full sentences. Nausea, no vomiting, diarrhea, or abdominal pain. No weight loss, fever, or chills. Patient appears anxious. They did a mistype on here. Shortness of breath for respiratory, no cough. Head, ears, eyes, nose, and throat. No changes in vision or hearing. Good dental hygiene. No sore throat, neck stiffness, or tenderness. Neurologic: awake, alert, and oriented. No headache, dizziness, loss of sensation, loss of function, numbness, tingling, or weakness. Cardiovascular: irregular heartbeat. Tachycardic, which is a fast heartbeat. Systolic murmur, which is abnormal heart sound with mitral regurgitation. And no cyanosis, which is blue coloring of the skin. She has no muscle or joint pain. Her abdomen is normal, soft, non-tender, and non-distended. No palpable masses. Her extremities: no edema, which means no swelling. No skin abnormalities. She has nausea, but no abdominal pain, vomiting, or diarrhea. She's not itchy, burning, and there's no pain with urination, and there's no blood in her urine. And no vaginal pain, discharge, or trouble with intercourse. LMP: her last menstrual period was 8 years ago. Sexually active, but only occasional with male friend with benefits, which is what I would have added myself. Okay, so we know she's sexually active, and we know that the chemicals at work are non-toxic. Spend 1 action per 2 questions. Okay, so I think now I want to ask her what supplements she's taking and how much sleep she's getting. Because when she started running, to me, isn't a big deal. Actually, I think it says it in here. No, it didn't. Oh, I think she told me, actually. She's been running for a while now. Where did it go? I lost. Oh, here it goes. Story card 1 is right in front of me. Whatever. Yeah, she's training for the marathon. I don't know how long she's been running. I feel like that's not important. What is important, though, is trying to figure out how much sleep she's getting and what supplements she's taking. So let's go into supplements first. RTG. G. Oh. Take story card 9. Whoa. Okay. I take a few workout supplements my trainer recommended. Today I took them around 8 p.m. I know a lot of people who swear by them. I've been more fatigued the last couple of days after running, so I started dry scooping, which is probably pre-workout, which means it might be something with caffeine. I saw it in a TikTok video. It's pretty cool. Instead of mixing the supplements with water, you take them dry. Makes them work faster. I've seen a real impact on my energy and performance during my runs. You want to see them? Okay, I've got them in my backpack. Okay, take story cards 18, 19, and 20. Okay, now we're really getting somewhere. Make sure I take a note of that. Sups. Let's start with 18. Okay. Unleash the power of nature. Surge Energy guarana shots are a healthy source of energy that contains more caffeine than coffee, but with a slow release for sustained power that will keep you feeling alert for hours. Make it part of your weight loss program and blast through your fitness goals. Supplement facts: Bioenergy Shot Organic. Servings per container is one shot. It's 11 milliliters. And caffeine from guarana is 110 milligrams. There's water, raw sugar, guarana extract, 8% passion fruit concentrate, and citric acid. So that's one thing she's taking. 110 milligrams. Keep that in mind. Human Power Sport. Human Power Sport. L-citrulline, 4,000 milligrams. Taurine, 1,000 milligrams. Nitric Oxide Booster, which has green coffee bean extract, green tea extract, turmeric extract, blueberry extract, and kale, 50 milligrams. Black pepper extract, 10 milligrams. I don't see caffeine, 325 milligrams. Let's start adding that up. 435 milligrams. She sound like me low-key when I used to be addicted to caffeine. She's getting fucked up by caffeine, y'all. Oh my God. Thermal burn, fat energy. Thermo burn, fat energy. Nope, fat burning supplement. 2 capsules. And I'm gonna skip to the good part. Coffee bean extract, 300 milligrams. And then on top of that, caffeine, 200 milligrams. So in this thing alone, there's 500 milligrams of caffeine. 500 milligrams. She's abusing. Yeah, this is almost 1,000 milligrams of caffeine. No wonder you're dying. 500, 825. This is what? Yeah, she's taking 935 milligrams of caffeine. What the fuck? 935 mg calf. Now, I can't. I genuinely am just. I'm shocked by all of this. Okay, so I've asked these questions. So now I'm going to. I should ask one more question, but I don't think I need to because I can't spend like if I jump to the codes, I'm going to you know what? We're gonna do a test. We're gonna skip the second action. We're gonna do a test. Now I want to see. I don't know if I should do blood work or if I should do. I think the echocardiogram is what I really want to do, but I need to see what that is exactly. What is an echocardiogram? Excellent question. An echocardiogram is an ultrasound scan used to diagnose and monitor certain heart conditions by checking the structure of the heart and surrounding blood vessels. It can detect damage from a myocardial infarction, heart failure, endocarditis, and cardiomyopathy, and other heart conditions. So I definitely want to run that test. Blood work would probably be a good test to run too. Yeah, we're going to do blood work actually, because it says a series of diagnostic blood tests, see previous items, and/or for specific substances like troponin when damage to the heart muscle is suspected. And there's a bunch of different blood tests. We're going to have blood work done. So I think I said it's to flip it. What should, just blood work. Yeah, I just want blood work done. Yeah, I don't need a drug panel. I don't need EKG. Do I need a drug panel low key? No, she doesn't take drugs, and caffeine wouldn't pop up in there. Blood work. So now, YTE is the code that we're looking for. Boppity boopity boppity boo. Blood work results. Chem 7 normal. Okay, hold on. Let's make sure we write this down. Blood work YTE. Okay, Chem 7 normal. Chem 7 test looks at 7 different substances in the blood, urea, nitrogen, or the BUN, carbon dioxide. I thought I said creatine, but it doesn't. No. Creatinine. Never heard that one because it doesn't say creatine. Glucose, chloride, potassium, and sodium. So that's normal. CBC is also normal, and CBC is the complete blood count test that uncovers a wide range of conditions, including anemia, infection, and leukemia. It can reflect problems with fluid volume, such as dehydration or loss of blood. CBC, normal, but her troponin is high. And I don't see where troponin is tested, but it's elevated. So troponin elevated. Okay, we've run through all of our tests. It is now 2 p.m. We're going to look at the status card and see what her current status is. WPS is her current status. And survey says that we need to take story card 15. Charlotte seems to be even more agitated than when she first came in. I'm really not feeling well. I feel like I'm having a panic attack, but much worse. She starts crying, hiding her face in her hands. Why is this happening to me? She suddenly looks up, her eyes opening wide. I need the bathroom. She gets up and stumbles into the bathroom. She closes the door and you can hear her continue to cry. When she comes out shortly after, she barks at you. Why aren't you taking care of me? Is there something you aren't telling me? Jeez, girl. So she angry. The status card I need to grab for that one. Don't like I'm updating my status card just yet. Okay, it's 2. We ran the blood test and we know her troponin is high. But what does that mean? I want to see what the hell troponin is, especially with her dad having a heart attack. Like that could be something that she, you know what? That's what we need to do. That's what we need to do. We're gonna get to the cardiologist. We're gonna get her heart looked at ASAP, as well as is there troponin just seems to be something with the heart though, no? Oh, here we go. Troponin, a type of protein found in heart muscle, normally is not found in the blood. Greater amounts of troponin are released in the blood when the heart muscles become damaged. Possible causes of elevated troponin include, okay, we're gonna get her to the cardiologist. Sorry about that. We're gonna get her to the cardiologist ASAP. Why you I? Why you I? Take story card 3. Let's actually put that in here. Okay, the cardiologist says her symptoms point to a heart condition. It's unlikely a heart attack, given her age and fitness level. Her father had a heart attack, but at a later age. I believe she has atrial fibrillation. I wonder what the cause is. However, you have a more pressing concern. Your patient is so agitated, I'm afraid she might have a stroke. Jeez. Okay. So what do I need to do? All right. So first of all, I need to calm her down, is what I'm being told, basically. Atrial fibrillation. Might stroke. Okay, so we need something for her nerves. What drugs we got for her? As crazy as that sounds, it might help. All right, let's see what this first one is. Amiodarone. What is that? Where are you? Drug to regulate the heart rhythm. Well, don't need that right now. Beta blockers. I feel like that's not also something I need right now. Yeah, heart rate. Don't need that right now. Blood thinners. I don't need right now. Nitroglycerin. Where you at? What you do? That might be something too. And what about a clot buster? No, she doesn't need. She's not having a stroke. I just want to calm her down. like because she's so agitated. Do we take her to a psychiatrist? Is that going to be OD? I think we take her to a psychiatrist. The psychiatrist says AAH. Take story card 31. Jeez. I'm nervous. Okay. If you have revealed a story card with this symbol, take story card 29 instead. So do I get story 29 instead? Oh, you know what? It says Shayla begins yelling when you suggest she should talk with a psychiatrist. I'm not crazy. Shouldn't we figure out what's wrong with me? She kicks a nearby table, then collapses in the chair sobbing. Nurse Judy says, maybe you can try again later when she's not so agitated. Okay, so take story card 29. I thought that might help. I honestly did. Because like it doesn't say like tell her the truth on here. And I don't want to just start giving her drugs either. You know what I mean? Okay. Shayla begins to resist as you suggest she talk with a psychiatrist. Then she takes a deep breath. Maybe you're right, she says. I'll see her. You stop by later to find out a consultation with the psychiatrist to manage her anxiety and stress was perhaps exactly what Shayla needed. Shyla. Well, I think it wasn't her name the whole time. I'm tripping. It looks like she just needs some time to be able to calm down first. Okay, take story card 32. So because she was as agitated as she was, I should not have done that apparently, but I got that symbol. So I took story card 29 instead. 32. Oh shit. Wait, what? Congratulations, Shyla has survived the night. If you've treated her symptoms, If you've just treated her symptom but don't know the underlying cause, Shyla will likely be back in the emergency room. You can keep working with Shyla until you're ready to complete your final report. Yeah, we're not done yet. Cause no. We ain't no. We ain't done yet. Because I definitely she's abusing this caffeine and her heart rate is all messed up. So we need to get that situated, like ASA MFP. So I think I want to give her a drug now before I let her go and before we move on to the 4 o'clock hour. We haven't updated her status report. She was still agitated and anxious. But yeah, I think it's time to give her some drugs. Something to help with her heart. All right, let's see. To regulate the heart rhythm. That might be one. Heart rate. Heart rhythm or heart rate? She doesn't need a blood thinner. I don't think she needs nitroglycerin. Yep. And I don't think she needs a clot buster either. Heart rhythm or heart rate? Atrial fib. Heart rhythm or heart rate? Where's the heart stuff? Heart health. So AFib. A heart arrhythmia that is often very rapid can lead to blood clots, which can be carried to the brain, can be detected on EKG. We're going to go get an EKG before we start giving her drugs. EKG. EKG. 2 to 4. QCY. We're gonna save her life. We're saving her life. She might have survived the night, but we're gonna save her life. And we're gonna make sure she doesn't pull a me. and doesn't abuse this caffeine. That's crazy, honestly. Okay, the cardiologist examines the test results and says Shayla's heart rate is more than 100 beats per minute. That's high for an athlete. The RR intervals are consistently irregular and the reading shows F waves. These are the classic signs of atrial fibrillation. And again, so okay, how do I cure AFib is what I want to know. Okay, beta blockers. Okay, so EKG, QCY, definitely AFib. AFib confirmed. All right, so again, her status card has not been changed. She's still agitated and anxious, but now it's 4 o'clock, and we're going to hit the FWW. She might have survived, but she ain't fixed. Take story card 10. When you look in on Shayla, you see that her condition has gone from bad to worse. Oh my God! She's pacing around her room like a caged animal and won't sit down. She sees you and rushes. As she does, she kicks over her backpack. Several items spill out onto the floor, including some supplements. Shayla immediately starts to hug herself and cry. Is it okay if I take a look at these, you ask? She nods. I already have those. I already have them. I already got them. So now I do think it's time for the blood thinner. It's 4 o'clock. We're going to give her a blood thinner. HGH. Oh no, that had its own code. Like I wish it was optional. It was just like, hey, like, stop taking so much goddamn caffeine. But you know, blood thinners do an effective job of managing the symptoms of a patient's atrial fibrillation while reducing the chance of a stroke. Take story card 30, then take status card 3, calm and stable. Okay. She survived, but she's gonna walk out of here anxious? I think not. Yes, sir. We're leveling up, y'all. We're figuring this out. We're figuring this out. You know what I mean? One step at a time. Story card 30. Status calm. Shayla has calmed down. Her heart rate and breathing have slowed significantly. She looks much better. You've successfully dealt with her symptoms and she is out of danger. Take story card 32. Now I can say she has survived the night. All right. So now we can write our report. So causes, what causes the patient's symptoms? Excessive abuse of caffeine. Shayla took well over recommended amount. What treatments did you provide? Beta blocker. What recommendations do you have for the patient in the future? Reduce caffeine. Stop dry scooping. Lay off guarana and fat burner, because that shit alone was crazy in caffeine. Like, my goodness. We did it, guys. And now we can happily read her epilogue. Okay, just before her run tonight at 8 p.m., Shayla dry scooped a supplement that had multiple sources of caffeine. One supplement alone, story card 20, had 200 milligrams, in addition to a second major source of caffeine, 300 milligrams of green tea leaf extract, for another 480 milligrams of caffeine, or total 680. And in 325 milligrams from the other supplement, 110 from her guarana, and Shayla consumed almost double the amount at which caffeine can start inducing toxic effects, which is 600 milligrams. To prevent her from having a stroke, you calm Shayla down. A psychiatrist could have helped her learn to breathe through her stress, but you would have had to wait until 4 when her body had already processed most of the caffeine that was making her anxious. That makes sense. Beta blockers would have stabilized her well. Blood thinners would have done the trick as well by addressing Shayla's atrial fibrillation triggered by caffeine and stress. But you'd want to run a pregnancy test first, since these drugs and others can be dangerous for pregnant women to take. And it turns out Shayla is pregnant. Oh shit! I was right! I called it in the beginning! She had an IUD inserted 8 years ago, but is mistaken about which type she has. She thinks she has a 10-year copper IUD, but really has a 7-year hormonal IUD that has lost its usefulness, which explains Shayla's surprise at her pregnancy if you gave her a pregnancy test. Given that removing an IUD has a 20% chance of causing a miscarriage and leaving it in has a 55% chance of causing a miscarriage, you should advise Shyla to remove the IUD. Finally, although, and I didn't advise her of that at all, and I don't know or don't remember which drug I even gave her now at this point. What did I give her? Beta blockers. All right, cool. Perfect. It's not harmful to pregnant women, so that's a good thing. Finally, although stress and high levels of caffeine likely trigger Shyla's chest pain and atrial fibrillation, mitral valve regurgitation was an underlying culprit. The MVR could be temporary if it is related to her pregnancy. However, it could cause longer-term issue if it is related to rheumatic fever Shayla had when she was a child. Because you can't rule out the rheumatic fever as the cause, you should recommend Shyla see a cardiologist after her pregnancy just to make sure. I didn't know the girl was pregnant. I didn't even know the girl was pregnant. Of course, you should advise Charlotte to stop using supplements immediately and to reduce her work hours. You should also strongly recommend she see a psychiatrist to help her rethink her lifestyle choices. Damn. 50 points. All right, score. Plus 50 if you successfully dealt with Shayla's symptoms and helped her make it through the night. I did. Plus 30 if you correctly identified caffeine from her supplements as the cause of her anxiety and potential for a stroke. I did. So we're at 80. Plus 15 if you uncovered that she was pregnant. I didn't. But I'm going to give myself half of those points. No, I'm going to give myself a third of those points because I thought that that was one of the first things I said to myself. I actually said that out loud. So I'm going to give myself 5 points. So 85. Plus 5 if you recommend that she has her IUD removed. I didn't. Plus 5 bonus points if you realize that although Shyla's chest pain, atrial fibrillation, and mitral valve regurgitation were likely caused by the caffeine, the mitral valve regurgitation could be a long-term complication caused by the rheumatic fever she had as a child. Nope. Minus 10 points if Shyla had a stroke. She did not. Minus 5 points if you gave Shyla either midazolam, amiodarone, or blood thinners, as these drugs should not be given pregnant women. I did not. Minus 5 points for each overtime action you took after 8 a.m. I did not lose any points. So we're at 85 points. I'll take it. And I took up too much of your time. Thanks for tuning in and stopping by, y'all. Until next time. In next episode 2, we're gonna do patient 2. So that one said medium. We're gonna see what happens. Until next time, you guys. This is King Echo, signing off.